So we move to the next stage. So you can see all 8 of them are really great. So one of the important part of running this program is finding the talent. And this is a good showcase that there is immense amount of talent is there in UNF. We just need to tap into it. So, and we were extremely lucky to have all 8 of them. And again, please let her give a little bit longer applause for all 8 of them. So now we like to invite our clients come to the stage and take a seat here. So as you can see, our clients are Baptist Health, Performance Academy, Girls Incorporation of Jacksonville, and Family Support Services of North Florida. So, and interns are important, means then the next is having a good projects are important. And for that, we need courageous people who are willing to question themselves and willing to put the data in front of them and try to make decision with it. So that takes courage to do it. And we got lucky in finding those 4 good people who are willing to do it and willing to work with us. So they have to now reflect what all this means. So 3 questions they are going to reflect on is now what is the main discovery for them? So we saw from our perspective, what do they see from what the findings we saw? Then what does that mean? What's the value of it? What is the impact of those findings? And the last one is, now what does all this mean? They got to keep going on their own, so how are they going to do that, right? So with that, we're going to go to the same order in which we presented the project. Julie?
Good evening. My name is Julie Schafer. I'm with Baptist Health. And we were very impressed, as I'm sure all of you were, with the students that we worked with and listening to the presentations. For us, preventive health, that's kind of the business we're in, partnering with the YMCA and working in the wellness area. It's hard sometimes to show preventive medicine. Really, if you're preventing something, it's hard to show it didn't happen. So the students did a great job of really learning our business. And for us, lifestyle factors is something we focus on. So I think I was surprised by just learning about metabolic syndrome and finding out which centers in our 5 various centers that we have, we really need to focus on it. We look at the community needs assessment, but sometimes that doesn't match up. So it validated what we kind of already were planning. And then also really trying to figure out our programming. So working on programming and deciding, should we focus on metabolic syndrome? One of our challenges is our billing, the CPT code, so a diagnostic or billing code. There is one for metabolic syndrome, but nobody really uses it often. So when we go to pull the data from our end, we're trying to pull high cholesterol, high triglycerides, high waist circumference if that's taken. So it's very challenging from a data perspective to really try to pinpoint how many people do have metabolic syndrome. And for our physicians, they do a wonderful job in the treatment arena, but they only have so much time to talk about all the things we raised our hands for, not sleeping, stressing, exercise, and nutrition. So the health coaches fill that gap. And so we hired health coaches 4 years ago. So we've been sitting on all this data for 4 years. And thank goodness this project came along because we were really sitting on the data and we didn't know what we had. So the students, Brittany and Will and the whole team and their mentors did a great job of helping us know our data. So we were kind of doing things every day, doing great services, but we needed the data to drive what we're doing with metabolic syndrome and also lifestyle management. So going forward, we're going to use this data to really pinpoint what programming we can do in the Riverside and Northside areas for metabolic syndrome, help our primary care physicians in this arena. So in 2016, we had 20 referrals from our primary care physicians to our 5 wellness centers. In 2017, we had 500 referrals. So we increased by just knowledge of what we can help that gap from the physician visit to just everyday life with what we face in our everyday life, sleeping and eating and nutrition and exercise. So truly, we would love to build on what they've already done, study people that are sent to a health coach from a primary care physician versus those that are not, and see the outcomes for metabolic syndrome based on what we've learned tonight, those that we do see, we either manage their health or prevent, and they don't go on to have metabolic syndrome and really impact Jacksonville in that way. So thank you so much to your team and the direction that you gave. We really enjoyed the semester working with you. So.
Good evening, everyone. So with the Performers Academy, the biggest, I guess, response to our wicked problem is that it's the way that we ask the questions. So one of the big things that we were able to get resolved with the UNF students was rethinking our pre and post assessment so that we're able to gain quantitative data from qualitative instruction. And so that was a piece that I was missing. So we were looking at, we provide a qualitative experience, and a lot of how we know how well we did our job is based on student testimonials and student behavior. And as you were saying, it's preventative measures, right? Behavioral intervention. So how we're trying to prevent them from getting into that fight at school or getting onto drugs. So how can I explain to a funder that I kept these kids off of drugs, right? They just never started. So showing the ways in which the students grow throughout the program, and showing a trend in students that took the program versus students who didn't take the program actually provides quantitative research to qualitative instruction. And that's something that's gonna be a long-term effect for us. And the pre and post assessments that we were able to rework, we've already been using and our program at DDC, which is the detention center that started after we started working with you all. And so we've already completed one post test on a student who was released, and it showed the gains in a way that we hadn't been able to measure before, so that was a big deal. In the future, going forward, what this looks like for us is being able to come to the state with more detailed reporting, and not just artwork, right, and videos and testimonials and music from the kids and exhibits. We can actually have data-driven results that make sense in the world of people who only deal with numbers, but also do justice and a service to our instructors and our staff that work really hard to make sure these kids are having meaningful experiences, because paperwork is a trigger word for a lot of our students, especially the ones coming out of the foster care system or who are looking at aging out of foster care. That's a really tough thing to deal with when you're 16 or 17 and know that at 18 years old, you're going to be taken out of your foster home, even if you're still a senior in high school. So then college doesn't become something you're thinking about. You're thinking about the paperwork, right? That's about to be pushed through, saying that you're no longer eligible for care. So we try not to, like in our entry and exit interviews, not to take notes and things because they've been seeing therapists for a really long time. And it's hard for us. However, what we're looking into is streamlining the program and doing note cards for the teachers on a day-by-day basis, or hopefully a nice application, web-based application, that they could just input the data after class on a daily basis and starting to document, as you suggested, breakthroughs too, not just incidents. So now when somebody does something really great, one of our kids does something really great, I'm gonna do the paperwork on that. That was wonderful. This piece is incredible. Let me document that. Let me put that in your file so that we can certainly reassociate their concept of what it means when an adult files paperwork on them. So thank you for that.
Good evening. My name is Dr. Robin Rose. I'm the CEO of Girls Inc. of Jacksonville. And let me just say, we loved every single minute of working with UNF and this team. It was fabulous. And so the big wicked problem that we proposed when we made application for this project was how is our data, what is our data showing us that shows that we're making small incremental steps to breaking female cycles of generational poverty and welfare here in Northeast Florida. Because I'm sure that some of you were looking at the data around body image and sexuality and whatever going, what on earth are you know, what is that for? So one of the things that we're very serious about our intentional and focused programming is that we want girls to succeed academically and to stay in school and to make on-time grade transitions and to know how to read, to learn about interesting STEAM careers and whatever. But we also know that if we're ever going to break poverty and welfare cycles, that we have to address all the myriad factors and the barriers that impact a girl from coming to school, staying in school, and learning in school. And as you know, this was our middle school program that they took a look at our data. So think about yourself in middle school. Think about what you were interested in, and it was about being liked and how you looked and being popular and about dating and about, you know, adolescent sexuality and all of those things. So this is what UNF was tasked to help us begin to analyze. So I think some of the wins that this data showed us was that we've made big progress, great progress over the last few years as to how we have standardized our process of data collection. And what do I mean by that? You know, if you do a pre-test, you know that you need to do a pre-test before you ever teach a lesson, because you want that baseline data that hasn't been influenced. And so this was some information and best practices processes that, since I've been the CEO here almost 3 years, that I've been helping my team standardize, understand how we need to collect data, because otherwise, if you don't do that, then what is your post-survey data going to mean? So, because you don't know if you have influenced it. So I was really happy to see that we've made great improvements in these processes. The other thing because of that is we are seeing that the longer a girl's in our program, as you saw, the better the results are. So the meaning that translates for us is to be in a school for multiple years, to have what was we all talk about in the sector, that pipeline continuum of programs and services that can build on itself, build on that knowledge that's age and developmentally appropriate so that you can actually do what you want to do, which you're in-game your vision of making sure that girls at least graduate from high school and are prepared to either go into the 21st century workplace or on into college. I think the holes that we saw is because when you have a quantitative assessment, it needs to be trustworthy. So it needs to be highly reliable and valid. And by that I mean the questions that you're asking, does it match what you're teaching in the curriculum? But do you have confidence that the tool was developed in a way that it's actually measuring what you want to be measuring? And I would say that because we are an affiliate of a national organization, that we get our curricula from our national organization as well as the tools. Any of you who've ever been curricula developers know how long it takes to not only develop it, but to continue to refresh it, and then also to make sure that your tools are still relevant and trustworthy. So we really have some work to do around our tools, and to make sure that, you know, that the data that we do get, that it's good, reliable, trustworthy data. Next steps for us going forward. You know, I know our national organization can't do these tools, correct these tools fast enough for how I want them to be done. So I think as we debriefed, I would love to write and win some big grant so that we can begin as an affiliate to begin to make these course corrections and develop new quantitative pre and post assessments for our affiliate, and not so that we are confident that we know we're making a difference in girls' lives. We're able to show our donors and funders the impact that they are getting as well. And I think that's one of our big issues on the horizon, as well as just to continue to plug away on that and make sure that when we do a program, it's for multiple years. And we're just so grateful. Thank you again.
Hello, everyone. My name is Stephen Rodrigues. I'm a process improvement specialist at Family Support Services, and I'd like to actually start out by saying, Tabitha and Habiba, wow, you did an absolutely fantastic job at taking a complicated system, a nuanced system, and looking at our data in a way that's helpful to us. And I want to get to the first question about opportunities. So there are a lot of opportunities based off of this data. We're going to be able to use this information to look into grant opportunities, to look at other funding sources, and something that wasn't mentioned today, but that's happening for the Florida Child Welfare System is that there are large funding changes that are going to impact the Florida Child Welfare System. And this information, I think, is going to help us bridge the gap in those changes. So I hope you both feel and your team feel that when we look at data and we look at numbers, we're talking about families, we're talking about children, and we're talking about the difference that this information can make for those families in the services and goods we provide. So next step is we want to pursue those opportunities, and we want to take that information and ensure that we're providing a quality and wide array of services and goods for our families, and that we want to look at this information and pursue attempting to tie it to outcomes for our families and children. So thank you both. You did a fantastic job. Thank you.